there any questions?
Yeah, Rob, thank you. Charlie Cadenas in Jacksonville, Florida. What an excellent panel. I have questions. I'd like to have questions for every single presenter, frankly, but since we're limited time, I'll limit my questions to Captain Nelson and his presentation on the cut suit. It's an extraordinary presentation, an extraordinary application, particularly in the light of events that just happened in Boston this past week. I mean, very similar to what we were seeing out in Afghanistan. And a couple of your slides really went to heart for me from my own firsthand experience that I'd like to talk with you later. But my question for you is the cost of putting on that kind of simulation, not just in the individual cut suit itself, which is something, but in the man hours and support gear that go into that. I was wondering if you could comment on that, on, for example, your estimate of the man hours for non-trainees that went in to just support that and to put on that kind of event. It's more than just the cut suit, clearly. It's the crowded environment of the tent, the chaos that's inherent to those situations and controlling that and working around that. And I thank you very much for your presentation.
Well, the outfit that puts out the cut suit is actually a former movie production studio called Strategic Operations. It's done a lot of work with the special operations community. When we did our last two exercises, we used 3 cut suits so that we could stage them, because it takes a little time to reset them for boluses of casualties. And for those 3 cut suits with 2 actors, and we used one of our own corpsmen that worked with us at 1st Medical Battalion as the 3rd actor, we paid about $4,500 for about 13 hours. And that included them coming up to the field area, driving up, setting up. It takes obviously time to set up. And then we actually, all of the injuries that we utilized were real life injuries that we brought back in terms of the presentation, the nature of the injuries, the physiology, and built that in. We utilized the SimMan type of monitors to actually present vitals until interventions were done, that then the heart rate would come down after you started to resuscitate the patient or after you clamped the iliacs. So they would bring up a crew of about 20 people or so, but that was included at about $4,000. And I don't know right now what the going price would be. I'm sure that has navigated upward from that. But we also too then use our own organic assets, probably about 15 or 20 corpsmen, and then up to maybe 30 to 40 subject matter experts that maybe were corpsmen that have deployed in the past that came from Balboa, from the Naval Hospital Camp Pendleton, nurses and physicians, and all of that in a financially constrained environment has been done really from a volunteer basis. We try to get people permissive orders so they can come, but they get no reimbursement for coming out and spending a day with us.
And I'd like to make a comment about your question, and this is kind of a generalized response to the question, it costs too much, and why I'm so proud of what SAGE is doing here with the military. The military realizes the value of a human life and is willing to spend the money. They spend it in aviation and other areas. How much does a flight simulator cost? $10, $15 million? And we are complaining about maybe $20,000 or $30,000 for a simulator today. It's not our problem. The problem happens to be that we cannot get any support for medical education. And probably one of the things that we need to do is, for example, systems like CutSuit will have enormous value, and I'm convinced that as soon as we get our randomized clinical trials done, there will be enormous difference between the two of them. There's no question about it. The realism is superb. But we are bulking at engaging in a new technology that clearly is going to be enormous value to us, and complaining that it costs too much and we can't do it because it costs too much. We have to find and address the issues from the political all the way down to local hospital level, how we can make these things affordable, but not so much affordable, but purchasable. You can't save a life cheap. You buy cheap, you get cheap. And so the problem that we have is that for some reason, the medical profession is expected to educate and train itself and cheaply provide education. This is something that we need to work at and turn around.
With that, ladies and gentlemen, I would like to thank you all for coming today. Excuse me. I'd especially like to thank my panel. I think they did all an excellent job, and the topics were just fascinating to me as a physician, as well as a military physician. And I also like to thank the SAGES for providing us this platform to speak. Thank you, and enjoy the rest of the conference.